Look, if your last vital signs assessment was more than 6 months ago, you should definitely sit down for this. But first, let me introduce myself. By the way, I'm Charles Maverick Simaala, a nursing student at Adventist University of the Philippines. If your last assessment was more than 6 months ago, you might want to reconsider your decision. Why, you may ask? Vital signs are the most important and crucial indicators of a person's body. Therefore, it should always be regularly assessed in order to look for any abnormalities and if the patient is healthy. But first, I'll show you how a nursing student should take your vital signs so that you'll learn something new. Hi sir, good morning. I am Charles Maverick Simaala and today I will be taking your vital signs. Is that okay with you?
Yes.
And before we start, are you comfortable or is there anything I can do to provide more comfort?
I'm already comfortable.
Okay, so let's begin. So as you can see, I greeted the patient warmly and explained that I'll be taking their vital signs to check how their body is functioning. In this video, I already washed my hands, which I will be demonstrating in another video. By the way, you should always make sure that the patient is comfortable and relaxed at the given moment. I begin by measuring the patient's temperature, placing the thermometer properly and waiting for an accurate reading. While waiting, I locate the radial pulse, count the beats for 1 full minute and assess the rhythm and strength. After this, I quietly observe and count your breathing rate without drawing attention to it for 1 minute.
2,000 years later.
After gathering the temperature, pulse rate, and breathing rate, I will take note of my findings on my piece of paper, ensuring that the data will be secure and private. Okay, sir. Okay. To ensure that no microorganisms are spread during the process, I will use an antiseptic cotton ball to cleanse the thermometer, this time from stem to tip. Whereas beginning the procedure, you should always clean your digital thermometer with an antiseptic cotton ball from tip to stem, storing it back in its holder after doing this. So at this point, you would have gathered the temperature, pulse rate, and breathing rate of the patient, accounting for 75% of the total vital signs gathered in this assessment, not including the pain rating and oxygen saturation, as those two are only sometimes used and assessed for. As you can see, I am positioning the blood pressure cuff correctly on their arm. Inflating it smoothly and recording the systolic and diastolic values. After all of this, I document all the vital signs accurately and report any abnormal findings to the patient, in which in this case, there was only one abnormality. His pulse rate was weak and thready, which made it difficult to find his pulse rate. But through persistence, I was able to record the pulse rate accurately and smoothly. Your temperature is 35.8 degrees Celsius, pulse rate is 60 beats per minute, respiratory rate is 16 breaths per minute, and your blood pressure is 110/80, overall indicating that their vital signs is normal. Thank you, sir, for cooperating, and see you again next time. Thank you, sir. So there you have it. Regular vital sign assessment helps detect health problems early, health changes over time, guide timely medical action to prevent serious complications. Again, I'm Charles Maverick Simaala, your nursing student at Adventist University of the Philippines.